Okay.
Hello everyone, my name is Olivier Lejus. I'm an acupuncturist practicing in Sydney, Australia, and I'd like to talk to you about the type of acupuncture I do in my own practice. It's called Toyohari, and it's a Japanese form of acupuncture which was developed by blind acupuncturists in the 1950s. It tends to be a lot more gentle than Chinese acupuncture, and it's very much based on a sense of palpation. So what I would like to do is demonstrate a few of the techniques that I use to give you an idea of what to expect when you come to my clinic. I specialize in the treatment of pain, chronic pain, acute pain, and also migraine, insomnia, digestive problem, and anxiety. So I might just now move to show you what I will do when I see a patient and the way I will approach my treatment. So after I see my patient, the first part of the treatment is really to ask questions about the person's health, digestion, sleep, pain, where the pain is located and all that, and you start to get a picture of where the problem could be. Acupuncture is about developing and harmonizing the chi, the energy in the body. So we've got different channels of energy. And in the case of this patient here, looking at the patients, I will see different imbalance. You might see on that might indicate or reinforce idea from the case study. For example, we can see like the toes are slightly curved, and then that could give me an indication that the liver is implicated, the liver being responsible for the tendon. So in that case, I will use a very fine needle. And what I'm going to do is I'm going to palpate the meridian where the energy is toward the acupuncture point. And then I'm going to insert the needle, as you can see. And then the needle is not going to go any further, so the needle doesn't actually penetrate the skin. What I've got to be able to do is feel the energy going at the end of the needle, gathering. So once again I show you, that's about as far as the needle is. It doesn't go any further, and then I've got to find the energy at the end of my needle. When I find the energy gathering, I actually press a bit harder around the needle to stop the energy leaking, and then I'm going to withdraw the needle very quickly. So I'm resting very thin and I'm withdrawing the needle now. So that will be the first step of my treatment for the liver. In the second step, I will use the needle to stimulate the kidneys. The kidney meridian runs this way, and it's just between the two tendons, just at the back of the leg. Then I will check the pulse. In Chinese medicine, you've got all different pulse related to different channels. And in the case of our patient, being the liver, we will check the pulse on the liver position. And I will expect the pulse to have changed with the channel being stimulated on the liver. The pulse already changed a little bit. Then I will look at the next step, which is to look for the kidney position. The kidney channel goes up through the leg, and I will just use another point in that area. Same thing, resting the needle, gathering the energy. And once the energy is gathering at the top of my needle, when I feel the energy, I just withdraw very quickly. And once again, I will check the pulse. So we have all different steps in Toyohari acupuncture. And basically, we're trying to harmonize the energy of the channels. If one is too high, the energy has to come down, and one is too low, the energy has to come up. And it's basically what acupuncture does. Another form of treatment that I practice, it's a technique called ear acupuncture, which was invented by one of my countrymen, a Frenchman, in the 1950s. And basically, the ear is a macrosystem of the whole body, so you can stimulate part of the body through the ear. So, for example, for this patient who has trouble sleeping, I will use a tiny little pellet
that I just stick on this part of the ear. That's it, just on this point there. This is called Shenmen, and it's one of the main points to actually calm the body. So they actually stick on, and you can leave them on for 3-4 days, and you can have a shower. You don't have any trouble, and easily they fall by themselves.
Well, it was a very, very short introduction to acupuncture, and I would like to encourage you to see an acupuncturist and just experiment with different forms of acupuncture. And acupuncture is not a cure-all for everything, but it can be very, very powerful, especially for chronic conditions or in combination with Western medicine. Sometimes the patient can still work with Western medicine, but lessen the dose of medication needed. Thank you very much. Bye-bye.